How many of you have heard that the specialty training in the UK is like 8 to 10 years long? I even heard people saying that I know or I have heard from someone that the training is so long and that's the only reason I don't want to go to the UK to train and become a consultant. What if I tell you, as an international medical graduate, there are different pathways where you can skip different parts of training and progress to become a specialist? Or better even, what if I can tell you there is a complete pathway where you don't even have to be in a training program to be a specialist in the United Kingdom?
If this is the first time you're checking out our channel, welcome. Basically what we do is we run a website that's totally free known as roadtok.com, and it will explain the ins and outs about everything related to the United Kingdom and what it takes for you to work as a doctor in the NHS. So if you've not already, please stalk us on all of our social media. Find us on Facebook, find us on Twitter, Instagram, and of course, YouTube. Don't forget to subscribe.
Hi everyone, my name is Ibrahim. I work as an internal medicine trainee in the NHS. So in this video, we are going to talk about different ways you can skip different parts of training program in the United Kingdom. The training program is something is structured by the different royal colleges of that specialty, and it is approved by the General Medical Council, and they give out the registration. So when you get GMC registration as a medical practitioner, then you kind of make yourself eligible to get into this training program, along with other required competencies and also required person specification to enter into a specific training program. But probably GMC registration is common in all of them as a medical practitioner. So getting into this training program is the first step of you becoming a specialist in that specific specialty in the long run. And GMC gives out specialist registration when you finish a training or an equivalent of a training, and that's what we're going to discuss today. So what are we going to learn today? So how to skip foundation training, how to skip core level training, how to skip higher specialty training, and basically along the lines of all of this, what is CCT, CESR-CP, or CESR? So it's generally called CESR, and we'll understand all these acronyms and what it stands for and how can you achieve all of this to get to the specialist registration by GMC. So first of all, obviously, you have to understand the structure of the UK medical training or residency. So I think this video is beyond the scope of describing the structure of UK training or residency. We have a free course in our Road to UK Academy where you can learn more about the postgraduate training and residency structure of the United Kingdom, where we have breakdown videos of explaining different specialties, like what's a run-through specialty, what's an uncoupled specialty, and different competencies required to get into different specialties and how to look them up on the internet. So I would highly advise you to go through the other videos in that course. To avail or to get into any of the courses run by us, just go to academy.roadtok.com and find the course which you want to know more about and enroll there. Moving on, let's talk about foundation training. So to skip foundation training, it's for an international medical graduates. The first thing, if you have an acceptable pattern of internship before even you apply for GMC registration, you automatically you skip the FY1, thus you get full GMC registration, and this renders you ineligible to apply for 2-year UKFP foundation program already. So if you have done an acceptable pattern of internship, acceptable by means of GMC, there are some definitions of that. We have written an article regarding what's an acceptable pattern. Be sure to check it out. If your internship is of acceptable pattern, then you don't have to do FY1. Basically, you are equivalent of an FY1. Now you're thinking about FY2, or in order to apply for any level training after a foundation training is completed, say for example, any core level training, either at ST1 level or CT1 level based on what kind of specialty they are, you have to have an equivalent certificate of foundation program. So you either get it by doing a foundation program. If you're not eligible to do so, then you have to do a FY2 level clinical work, equivalent clinical work. Normally it's termed as a locally employed doctor non-training job. So these are the initial jobs a lot of IMGs take when they start in the NHS. It's a trust grade jobs, either as an F2 level or even as a CT1 level, but they basically work towards getting their CREST form signed. So CREST stands for Certificate of Readiness to Enter Specialty Training. So if you have done everything in the CREST form as it says in a job of an equivalent level outside the UK, you technically can get it signed outside the UK as well. But remember that the form suggests a lot of things which may not be available for you to prove if you have not worked in the NHS. So it's best, I think, if you use your work experience as a non-training doctor for however duration is. The minimum has to be 3 months. The maximum could be as many months as you want to work, and use that work experience to get that CREST form signed, which completely skips your foundation training. So you don't have to go through a foundation training if you have means to get a CREST form signed. So other pathway is going through an FY2 standalone. I mean, it's not other pathway, but it's that you don't have to do 2 year, because either you're ineligible or you're eligible. Either you're ineligible to join a 2-year program because you've done an internship, and now you're eligible to join an FY2 standalone program, which is a 1-year foundation training program run by UKFP on the posts that are available for an F2, but you have to have GMC registration to get into this program. Now you may ask whether CREST is less of a value than Foundation Program Completion Certificate FPCC. No, it's not. So it's the same and equivalent. So if you apply for an ST1 program or a CT1 program, which is a training program, and you have CREST form signed right after working for 4 or 5 months in the UK, and you have your portfolio ready and everything fine, and somebody applied after doing 2 years of foundation program, there is no distinction or difference between you two, because this form is the equivalent of foundation competencies, and it will be seen as the same equal of a foundation training. So it's now up to you whether you're eligible to get into UKFP. If you're not, then obviously your target would be to get the CREST form signed as soon as possible, targeting which training application round you're going to apply for. Now comes a bit more complicated part, core level training. So core level training is very different from specialty to specialty. Specialties which are uncoupled, they have a separate core level training. Say for example, most of the medicine specialties, I think all of the medicine specialties, like you can't start from cardiology from day one until and unless you have finished core level training of internal medicine training for 3 years. Cardiology being a group 1 specialty, it is now IMT for 3 years. Other specialties like oncology, hematology, which are group 2 specialties, for them you have to do internal medicine training for 2 years. So you see, internal medicine training is sitting before those specialties, but other specialties which are run through like pediatrics, GP, obstetrics and gynecology, those specialties starts from ST1, and there is no separate core level training for them. But for pediatrics training, say for example, ST3 is a bit different level of training. So there are levels of training in those trainings, level 1, level 2, level 3 competencies. So to get into a level 2 training directly, if there's any post available, you have to prove that you have the level 1 competencies first. The same goes for psychiatry. I've done a recent video on psychiatry training where you can see that to prove that you have achieved or you have enough experiences of doing a core psychiatry training, you can get a certificate signed, and that certificate would generally be called alternative core competencies certificate or alternative core competencies form. So it will be different for different specialties. You'd be able to find this form in that specialty's recruitment website. Most of the time in the document library of that website, you will find the alternative core competencies form. If you want to apply for a higher specialty, want to bypass this core training, you have to look at that form and see whether you have proof of doing everything. And most of the cases, it's not about proof. It's about a consultant giving you that that write-off or sign-off that they have observed you doing the whole thing of the curriculum, and they are happy for you to apply for a higher specialty training, and you are capable of undertaking the job of a core trainee doctor who have gone through the training program in the United Kingdom. So basically, again, it's an equivalent certificate. CREST was an equivalence certificate of the foundation training. This alternative core competencies will be an equivalent certificate of your core training. So if you can get this alternative core competencies signed in 1 year, for example, then you don't have to go through 2 or 3 years of core training again. How we can do that? Maybe in 1 year you can prove to the consultant that you are capable of working in that specialty and you're capable of performing all the things that is mentioned on the form. So it's very crucial to find out which alternative core competencies form you need to bypass that specialty. So it's varied from specialty to specialty, because here you have delved into a bit more specialty specific things. So core psychiatry would be more related to psychiatric problems, whether you're capable of dealing with this and that, and it would be more like same as go for core surgical training. If you want to bypass core surgical training, there is a certificate of readiness to enter higher surgical training. So they have given a full name to their alternative core competencies form. So check that form, talk to a consultant, draw up a plan, how can you achieve all of the things mentioned in the form, and do it accordingly and get it signed by the consultant. Voila, you have bypassed the core level training. As I said, this form is a bit extensive, and at the same time it will require to be like, in a work in a more breadth. So I don't assume that you will be working as an F2 and will have enough clinical responsibility or exposure to get an alternative core competencies form signed. So I think gradually you have to take a higher job, like say for example trusted registered job or something like that, to be eligible to get this alternative core competencies form. It's just my understanding. It could be different, but I think in order to prove to your consultant that you can get those things signed, which is mentioned in the core competencies form, you may have to work in a more either CT1 grade, at least as an SHO, maybe not a registrar, and also finish the Royal College's exam to firmly say that you actually achieved and proven your competencies in that specialty, and it will help you to get that form signed from your consultant. But at the end of the day, it's all about the finding a suitable consultant, or finding a consultant who would be able to guide you to get this form signed. It's not something of their responsibility, it's your responsibility, because you are doing it on your time. So the final step of the training program is the higher specialty training program, which could be starting from ST3 or ST4. For an run-through specialty, obviously it started at ST1, but if you could prove that you have done the level 1 competencies, you can probably join a higher training directly. Now, what if you don't want to do higher training at all? What if you have enough clinical exposure in your country, or you have completed a postgraduate training in your country for at least 6 months or more than that, and you have completed your postgraduate medical qualification in your country, and now you came to the UK by whatever pathway, and you're like, why do I have to redo my entire internal medicine training or entire radiology training or whatever specialty training again? Is there any way I can prove my competencies of a specialist in my country, what I've gathered to the United Kingdom? Yes, there is. So this is called CESR, so Certificate of Eligibility of Specialist Registration. So CESR is the pathway to completely skip the structured specialty training. I want to give this a bit of explanation here. So the idea of specialty training in the United Kingdom, so it's like a syllabus or a pro forma, I would say more of a protocol written by the Royal Colleges, that these are the things a trainee has to prove, or the trainee has to do, in order to prove they are competent in this specialty. So it's written up by the Royal Colleges, the respective Royal Colleges, and then it gets approved by General Medical Council, which is GMC, to award recognition or registration of that specialty training. But who implements it? So these are implemented by different deaneries and Health Education of England in England and the equivalent organization in Scotland, Northern Ireland and Wales. So Wales deanery would be somebody who is dealing with the providing education following the map of the curriculum that's made by the Royal College and approved by GMC and implementing it with the trainees. So basically the trainees are working in NHS hospitals following the curriculum made by the Royal College of their own specialty, monitored by the Health Education of England and the deaneries. So I know it may feel like a complicated process, and I think it is. I mean, for an international medical graduate myself, it took me a long time to actually understand, and I'm not quite sure I understand it fully. But you see, the training program has so many wheels and cogs pulling it together. So there's a lot of ifs and buts, and at the same time the program has to maintain that they cannot just make you sit in one place in one hospital and get trained. In order to make the NHS work, they have to move around the different trainees. So for example, 6 months or 4 monthly rotation in either different hospitals, and basically gives you the breadth of experience of working in different kind of NHS hospitals. It could be district general hospital, could be university hospital, could be community hospital, depending on the specialty. So you see, while you are in a training program, you get to experience different hospitals, and that's the part of how training is conducted. But what if you decide that I don't want to do that? I don't want to get or sign up for this kind of program, even though I know that is an approved training program. I just want to work in one hospital, and I want to gather all the evidences for my becoming a specialist working in this hospital, and gradually I want to support my portfolio or enrich my portfolio just by working in this hospital. And that's what CESR is. Now, with that explanation, it may sound simple, like, you know, why don't everybody do that? Why don't just everybody go and find a job and just don't leave and just work in the specialty and do CESR? Why they go through all the hoops and training and everything? To be honest, in my understanding, even if in paper CESR sounds quite plain and simple, but I think in practice it's not that plain and simple. The guidance that is drawn up by GMC to support your CESR application, or like what you have to do, I personally think it's probably not that easy to gather or amass all the evidences by yourself without a supportive environment. And that's why I think many hospitals and trusts have started having CESR supported posts. So these are specialty doctor posts which are advertised as such that they will support your CESR application and help you grow. So if you are that kind of an individual who has enough experience and completed some sort of postgraduate training, I think this would be your target when you come to the UK to get into a specialty doctor post and CESR. The thing is, as I said, if you can't get into this kind of post, I mean, with your minimal experience, probably you'll not be able to get in this kind of post. And that's why the initial thought that why don't everybody just do it is not feasible. So if you are that kind of an individual who can get into a specialty doctor post because you have amassed enough experience in the specialty in your own country and passed all the relevant exams, or have enough breadth of clinical experience that you can undertake a specialty doctor post, then I think that would be your pathway to go for those specific kind of job in the NHS, to find out and get into a specialty doctor post and progress your career that way towards CESR. And as I said earlier, GMC has each specialty specific guidance for CESR application, which includes every little thing, evidences that, and how you have to supply your evidence. And I think sometimes different royal colleges as well supports your CESR application, because at the end of the day, whenever you apply to GMC with your CESR application, it goes to the relevant royal college to ascertain whether the evidence that you have provided goes in line with the curriculum they made for the training program. So basically, I think some royal colleges also have CESR support or CESR support sessions where you can undertake and actually see what you have to do to get the specialist recognition without going through any approved training program. Now let's go through these terms a bit. So CCT stands for Certificate of Completion of Training. So this is basically an approval of your training program, which is an approved training program in the United Kingdom. So the training programs that you joined, like starting from IMT1 as a medicine doctor, IMT2, IMT3, then I went to a specialty ST4, ST5, ST6, ST7, and then I got a Certificate of Completion of Training, which if I have completed my IMT stage 1 and stage 2, so I'll get a CCT in general medicine, and also if I go through another specialty like geriatric medicine, cardio, then I'll get a CCT in cardiology as well. So I'll get dual CCT in cardiology and general internal medicine, because I have done IMT and also I have done the cardiology training, which was mixed with internal medicine as well. So that's how you get a CCT. So your training program is approved training structure. Even though it sounds quite simple, but I think there is a bit of complexity in it as well, because each and every specialty that awards a CCT, the GMC has a guidance of how much minimum number of years that you have to do in an approved training program. Some specialties have no minimum number of years. So if you just even can prove all your equivalent competencies and shorten it to just 2 years, and in that specialty, you may get a CCT by just doing 2 years of the specific. This has recently been changed. So there was a period where this was given, which is CESR-CP. It's a CESR Certificate of Eligibility of Specialist Registration Combined Program. So this was mainly awarded to the individuals who partly did the training in this country and partly proved it by alternative competencies. So CESR-CP, previously it was like that, but I think right now a lot of CESR-CP or even CESR consultants who was awarded CESR, even going through an approved training program, are retrospectively getting CCT because of the change in guidance. GMC has a list of the minimum number of years that is required to be awarded a CCT in that specialty. If somebody like ago has completed at least that amount of training and had was awarded CESR or CESR-CP, now is eligible for CCT. So you see, the CCT will be given if you complete minimum number of training in that specialty as guided by, I think it's European legislation. So GMC has a long list of specialties that has indicated how many years of minimum training that is required in that specialty to get a CCT. So if you do that, you'd be getting a CCT. And lastly, CESR, I think I have touched pretty much more extensively on CESR already. So CESR is for somebody who has not got into any approved training program. They have just completely taken the CESR guidance by GMC and submitted the application, collecting all the evidences by themselves without going through a training program. And that's how you get CESR, which is a Certificate of Eligibility of Specialist Registration. Now, I think the inevitable question: is there a difference between a CCT consultant and a CESR consultant? To be honest, in practice in the United Kingdom, I won't even know which consultant is a CCT consultant or a CESR consultant, because, or to be honest, a CCT specialist or a CESR specialist, because the recognition was given and awarded by GMC, who were on board with the Royal College. So when a person gets awarded a CESR specialist registration, it's not like that whatever work or whatever evidence they have put forth has not been like seen or approved or analyzed. So it has been analyzed and it has been found equivalent to a CCT, and that's how they are the same specialist. So in my practice so far in the United Kingdom, there is no difference between CESR specialist or a CCT. I wouldn't even know who is a CESR specialist or a CCT specialist, but whether the value of that specialist registration is any different in other countries. If you go, that I got to GMC specialist registration by CCT, or I got GMC specialist registration by CESR, and now I want to work as a specialist in a non-UK country, I'm not quite certain about that. I have heard that there is a difference. Like if you want to go to another country, they value CCT specialist registration a bit higher than a CESR specialist registration. But in my knowledge and understanding, in the United Kingdom, to be employed as a consultant, you just have to have GMC specialist registration, irrespective of whatever way you got it by either CCT or CESR. That wraps up our video today. So I tried to explain as much as I can to different parts of the training and how to skip. If you have any questions, please comment in the comment box below. As always, if you have not subscribed already, please subscribe to our YouTube channel and hit that notification bell to get notified whenever we're out with a new video. Like us on Facebook, follow us on Instagram and Twitter, and see you next time. Thank you.